Welcome. My name is Russ Derry. I'm the Pediatric Epilepsy Program Manager at Mott Children's Hospital, and we're pleased that you could join us for today's epilepsy expert webinar on dietary therapies for epilepsy. What was that?
Joanna just joined, so it was echoing.
Oh, okay. Edit that part out. But yeah, thank you for joining us for our webinar called Dietary Therapies for Epilepsy. And we're pleased to have with us today Paige Rieckhoff, who is our outpatient pediatric epilepsy nurse practitioner. She sees a ton of patients on an outpatient basis and has a lot of experience with the ketogenic diet as well. And then also Christine Varner, who's our inpatient ketogenic dietitian. We're really pleased to have both of you here to share your different perspectives on dietary therapies for epilepsy. We will have an opportunity at the end of the presentation for questions, so you feel free to hold your questions until the end. If you do have anything that is specific to a particular piece of content, you can feel free to type in a question in the chat during the presentation, and our presenters may be able to answer that if they see that. So with that, I'll go ahead and get started.
All right. So today's presentation, we're going to talk about the dietary therapies that we offer here at Mott Children's Hospital. We'll talk about how the diets work, who should consider them, possible side effects, and the outcomes of the use of the diet. We'll also talk about how the diets are initiated and the day-to-day aspects of implementing them. We'll talk about common ingredients, meal ideas, the challenges of the diet, and some tips for success. So the ketogenic diet is a medical treatment for controlling seizures. It works by switching the body's primary metabolism to a fat-based energy source rather than utilizing glucose or sugar. The ketogenic diet is an established, effective, non-pharmacological treatment for intractable childhood epilepsy. And from numerous studies, we've seen that over 50% there's improvement by over 50% on the ketogenic diet for seizures. And 1/3 of the patients that are on the ketogenic diet have an over 90% improvement. And about 10 to 15% are seizure-free with the use of the diet. Our team consists of an epileptologist, the epilepsy nurse practitioners, the ketogenic dietitians, the social worker, the clinic registered nurses, and the ketogenic diet coordinators. There are a couple variations of the ketogenic diet that we use here at Mott. The traditional ketogenic diet, can you go back? Sorry. All foods are weighed on a gram scale. Typically, our ratios are a 2-to-1 or a 4-to-1 ratio. And when we talk about ratios, we mean the first number is grams of fat, and the second number are grams of protein plus carbohydrate. So a 2-to-1 ratio would be 2 grams of fat to 1 gram of carb or protein. A higher ratio at 4-to-1 would be 4 grams of fat to 1 gram of carb or protein. With the dietitians, we work to provide a correct balance of nutrients. There's pretty intense caregiver education over about 3 to 4 outpatient education visits prior to the hospital admission to initiate the diet. And during the admission and post-admission, we monitor blood ketones and blood glucose. The modified Atkins diet is also a type of dietary therapy we offer here at Mott. It was created at Johns Hopkins. It allows for a less restrictive dietary plan. We typically have kids on about 10 to 30 grams of carbohydrate a day, protein isn't limited as it is on the ketogenic diet. And it's still pretty high in fat. And we have found that with research that modified Atkins diet is nearly as effective with the ketogenic diet. We try to keep the modified Atkins diet limited to kids over the age of 7. It's a little bit easier for kids who are more used to managing their own diet. So kids in like high school, kids going off to college, just because it doesn't require a gram scale. It can be a primary choice of treatment based on like the kid's needs, the kid's age again. And it can be used as a first-line treatment for dietary therapy, though we kind of keep it with the ketogenic diet. Usually we don't initiate unless kids have failed 2 medications. So again, it is as effective as the ketogenic diet, especially with myoclonic atonic seizures. Go ahead.
Okay, unmute myself here. So there's the medical considerations, obviously, that we need to take into account before or while we're managing a child who's on dietary therapy. Sorry. So there's really 3 medical indications for dietary therapy. The first one would be medication-resistant epilepsy, and that would be someone who's tried 2 appropriately prescribed medications, so medications that are the right one for their type of epilepsy. They've gotten to the sort of maximal or goal dose of those medications and continue to have breakthrough seizures. That's the primary diagnosis that we use for this treatment, and that's what most of the patients on this treatment have. There's also 2 disorders. One is called GLUT1 deficiency and the other one pyruvate dehydrogenase deficiency. And both of those, actually it's indicated to be on the ketogenic diet to help manage those 2 deficiencies. So we have a small handful of patients with those disorders as well here at Mott. Other things that we take into account when thinking about whether the ketogenic diet is right is if someone's able to tolerate feeds. And that can be feeds by mouth or through an NG tube or through a G or a J tube, however that works for your child. The child's nutritional status is also really important to take into consideration. If you're already struggling to gain weight, if you're already having issues with like constipation and reflux and things like that, it makes a lot of sense to address those before getting on the ketogenic diet, if that's possible. The family support system, this is a pretty heavy and intensive treatment regimen. It's a lot more work than taking a medication twice a day. And so just making sure that the parents of the child, feel like they have the support both at home and then if the child goes to school to be able to provide dietary therapy. Along with that patient and caregiver motivation, this is never a therapy we're going to put a teenager on against their will because they won't do it, right? They have control over their bodies in that way. And then insurance, unfortunately, has become something that we have to take into consideration. There are certain insurances that are starting to restrict certain aspects of the diet, like covering the hospital stay for the initial admission. And so those are things that we take into account. Doesn't limit and mean that you can't do it. We just might have to change your insurance provider before we would get you started on the diet. There are a few absolute contraindications. So if I'm thinking about whether or not someone would be a good candidate for the diet, one of the first things that I'll do is have a very, very lengthy set of labs drawn for the child, because if you have one of these deficiencies, it will show up on those labs and then it will tell us like, oh, hey, we could actually make you sicker or make you worse by putting you on the diet. Other things that I sort of touched on, but like other considerations, again, if we're really struggling with your nutritional status or with constipation or reflux, that would be something that ideally is addressed beforehand by the GI team. For some patients that are undergoing a surgical evaluation for their epilepsy, we might put dietary therapy on hold. Although for some, we say, let's just do both, right? Like if things are getting really rough enough, let's get diet going while we're working on your surgical evaluation. It sort of just depends on how things are going. And then if we are really struggling even before starting the diet with caregivers being able to, follow recommendations and follow up with us and give us updates, those are things that we would want to address and work through before we move forward with starting the diet. This is sort of a typical timeline for starting the diet. So let's say you're a patient that I follow in clinic and you've met criteria for refractory epilepsy. This is something that will come up and we'll have a conversation about it. Typically, if you say, yep, I'm interested, let's go, then I'll put the referral in and then also get that big set of labs that I talked about. There's a packet that will come to you from one of the ketogenic diet coordinators, and that has to be filled out and turned back in before we start moving forward with scheduling. So you'll then meet with a social worker to go over an assessment there, get your education sessions taken, put together as an outpatient, and then we get started with the diet. So if you're going to start on the ketogenic diet, you would be admitted to the hospital and start it there. If you're going to do modified Atkins, that would be something that you start at home. And then we have pretty close follow-up once the diet is started, with visits at 1 month after starting, 3 months, 6 months. And then if things are going well, we can start to sort of space out. Sometimes we do keep seeing you every 3 months for quite a while just to make sure that things are continuing on, because usually these are our kiddos that we want to keep a close eye on. We always ask that you give dietary therapy at least a 3-month trial before saying like yes or no to it. Usually by 3 months, you've adjusted to the food that you're being provided. Most kids have declared whether they're going to get into what we call ketosis or like start making ketones. And it can really sometimes, unfortunately, just take, even with kids in ketosis, that long to sort of figure out the regulation of everything and to really start to see something. So I've had a lot of families at 2 months be like, we're not seeing anything, it's not worth it. And I'm like, can you just give it 1 more month? And they do. And that's when like the results start to happen. And so we ask for that amount of time. But at that 3-month visit is when we also check in and are happy to say like, hey, this isn't really doing anything for your kiddo. Let's switch back and start trying a regular diet again. Couple of other medical considerations when someone's on the ketogenic diet, most of the liquid medications that they take are full of carbohydrates, right? That's what makes them taste good. And so we don't want them to waste all of their daily carbohydrates on just their medication. And so we switch their medicines over to tablet form. And we teach you how to crush those tablets and dissolve them in water and then let the child swallow those if they're not able to swallow medications yet. There's also a few medications like zonisamide and topiramate that along with the diet can all increase the risk of kidney stones. So sometimes we might consider tapering off one of those beforehand or making a plan of how we're going to monitor closely to make sure that you don't develop kidney stones. There are quite a few side effects for the ketogenic diet. The short-term ones, which we monitor for closely while you're in the hospital: nausea and vomiting, sometimes some low blood sugar, becoming a little bit more sleepy or lethargic, some belly pain, refusal to eat, and all of that is related to your body going from being at a neutral pH balance to a more acidotic pH balance. And so that's why ketogenic diet is traditionally started in the hospital and like allows us to do really close lab monitoring. Longer term side effects and things that we're going to monitor for in the outpatient setting are things like kidney stones, not decreased linear growth, so just maybe not meeting your growth potential overall if you're on it for a long time, hyperlipidemia or high lipids in your blood, carnitine deficiency, constipation. If someone already has GERD, we can, like I said, make it worse, and then poor bone density or osteopenia.
All right. So these are some of the foods that we will use for the ketogenic diet. Again, we also measure everything on a gram scale, so that's also on there. We use a lot of olive oil, butter. We try to make sure there is some balance in providing vegetables, fruits. We try to stick with berries as they are like the lower carb option for fruits. And then for proteins, we use bacon, chicken, things like that. So to prepare for your child going on a ketogenic diet, we do provide education by our outpatient dietitians. The visits are usually between 2 and 4 hour-long visits with the caregivers. During those visits, you'll learn about the diet, what the admission process is like. We'll talk to you about your child's food preferences. We'll also work with you on a tool called the Keto Diet Calculator in order to kind of plan for the meals your child will eat when they're here at the hospital and also once you go home on the diet. So those education visits are, again, about an hour long each. And depending on your child's needs, we do 2 to 4. If your child is tube fed, there's usually less education visits, but we'll do about 2 visits for those and talk about like their tube feeding plan and any intolerances that they have. The inpatient initiation, generally children are admitted to the hospital on a Sunday afternoon, and parents should plan to be here about 3 to 4 days, depending on the child's tolerance to the diet and how quickly they go into ketosis. During that time, we'll continue the education. We review the diet process, we do more meal planning, and I spend about like 8 to 16 hours, a couple hours a day with the family, just preparing the family for homegoing so that the diet can be managed once you guys are at home. So during the admission, again, it's about 3 to 5 days. There are daily labs. We check a BMP, which is like a complete like metabolic panel, checking for a few things. Then we also check a lab called BHOB. It's where we check the blood ketones. And during the admission, I would work with the family to do education, meal planning, some more training on the keto diet calculator. We also teach families how to use a ketone and glucose meter when you're here at the hospital so that you can check ketones and glucose once you take your child home on the diet. And then we also do some troubleshooting with the diet based on the child's preferences and how they're eating and make adjustments to meals, all of those things that come along with eating a brand new diet. It is different than a usual diet, and so it does take some time for the kid to get used to it, and so we always just make adjustments as needed during the admission. So this is what a typical ketogenic diet plate can look like. So this is about a 2 to 1 ratio. So the plate would be about 82% fat, 12% protein, and 6% carbohydrate. We try to prioritize protein over carbohydrate just because we need to make sure that the child is getting the protein needs, their protein needs met. So because the ketogenic diet isn't always a nutritionally complete diet, we do recommend that children are on a multivitamin. Unless they're tube fed, the tube fed formulas usually provide the nutritional needs that they have for vitamins and micronutrients. But for orally fed kids, we do recommend supplement. We also recommend vitamin D supplements, and then some of our kids will require a levocarnitine supplement, and that assists with fatty acid metabolism. We also check for iron levels to make sure that those needs are being met and supplement if needed. Continuing the diet, is it you?
Yeah, me. No, you're fine. So you've gotten your kid on the diet, you've gone through the hospital admission, and then what happened? So when you go home, as Christy has sort of alluded to, you'll receive a ketone meter where you can check the blood ketones at home and blood glucose at home. It's similar to like if you've ever seen someone check their blood glucose, so it's a small prick of the finger. If you're on the modified Atkins diet, you can actually check your ketone levels through a urine sample as well. So we'll teach you all about how that works at home. But it gives you really good daytime, like in-time feedback, right? So it lets families see like, okay, today our ketones were this, and we saw this many seizures. And then we kind of, again, it's not a day-to-day thing. It can be a long term. It's a marathon, not a sprint. But we want to take the time to be able to have those numbers and give us that feedback to sort of see where things are going. We also will have a more full, complete set of labs done as an outpatient. Usually within the first month, we like to see at least one set. And we're again looking, and then we get them about every 3 to 6 months, depending on how long you've been on the diet and how stable you are. But looking for some of those side effects that we talked about, making sure that you're nutritionally in a good spot, that your micronutrients are where we want them as well. Both the neurology clinic and the dietitians are available, as we always are in the clinic here. So Monday through Friday, from is it like 9 to 5, someone is available to be able to answer questions for you and help troubleshoot. Some families end up needing like a little bit more frequent check-ins with the dietitians and that early stage, just to say, hey, we're seeing this, can you help us troubleshoot this recipe, that type of thing. And then if you're having more medical concerns, right, so like worsening of side effects or seizures are getting more frequent or less frequent, just checking in with your neurology provider to sort of let us know how things are going. We very rarely would wean any anti-seizure medications for the first 3 months that you're on the diet. We're letting your body adjust to this whole new change in the way that it's functioning. And so we don't want to throw any other variables in there. So typically for that first 3 months, we keep your medications as they are, or if, let's say, seizures got a little bit more frequent, we can even go up a little bit on meds. And then once we're at that 3-month mark, if we've made the check-in, we think that things are heading in the right direction and the child is doing better, then we would feel comfortable starting to maybe walk back some of the medications that they're taking. Let's see, I think that's everything there. A couple of more long-term monitoring things that we need to look at. So because this diet is so high in fat, many children will develop high cholesterol and high triglyceride levels. And we work really closely with our cardiology team here if we feel like that's something that's necessary to send you to be able to give us feedback of like, is this a safe level? Do we need to start intervening? And at what point do we need to step in? And then for children who have been on the diet for more than 2 years, specifically those, we have some who have been on for 5 years, 10 years, we really do need to look into their bone density. And so a DEXA scan is a scan that looks at their bone density and tells us, are they at a safe place or is this somewhere where we need to intervene? And if so, we would have them see the endocrinology team who can help make recommendations for us on how to manage that. So let's say we're at the point where we don't think that we want to be on the diet any longer. There's lots of reasons to come off the diet, right? One would be if it hasn't been clearly efficacious. And so that would be a reason to do it. Another would be prolonged seizure freedom. So if you've been seizure free for 2 years, just like with any of our medications, and we start having the conversation of, is it time to wean off the diet? And then of course, if you have intolerable side effects, so like the constipation just gets so bad, the GI upset, those would all be really good reasons to do it. Another reason I don't think I included here is that there are some kiddos who just really do everything, family does everything right, everything looks good, and their bodies just don't really switch into ketosis and produce those ketones. And so if it's been 3 months and we've tried that, then we start taking them off. Similar to like coming off a medication, we don't just stop the ketogenic diet and switch back to a regular diet. You work closely with a dietitian to just slowly lower that ratio back down and introduce non-keto foods over weeks and weeks and weeks and weeks and weeks, and allow your body to make that adjustment back out of ketosis. So we know that 3 million adults and children in the USA have epilepsy, and about a third of those are medically refractory. And so we estimate that up to 45,000 people could be helped with dietary therapy, and 135,000 of those people could become seizure free. So if it's something that you've thought about or considered, it's definitely worth asking your provider about and thinking about talking to us to see if you'd be a good candidate. I think that is it for us. We'd love to hear questions from those of you who are here.
Great, thank you. And if you want to end your screen share, we can open it up for questions.
Sounds good.
again, feel free to unmute yourself if you have a question or type in the chat.
Hi there. Thanks for for the talk today. I have a son who's 3.5 with focal epilepsy, and we're pretty well tolerated with medicine. So it doesn't sound like this diet is for us. But my question is sort of, would this be like an all or nothing therapy, or would there be some benefit into sort of shifting more towards a ketogenic diet? Maybe not fully, but yeah.
That's such a good question. Yeah, we get that question a lot. So the efficacy of the diet is not so much about restricting the carbs, but it's about using fat as your primary fuel source that you're burning, right? So all of us are walking around right now using carbohydrates as our fuel source. Switching to fat being that primary fuel source by limiting carbs so your body can't sneak and find the carbs is the way to do it. So many parents will think like, well, if I just restrict some carbs, like don't give sugary treats or, take away breads and things like that, will that help aid with things? And it really doesn't. We don't find in the research that that's super helpful for kids. And especially at your son's age, if he's doing well, and this is something that we could potentially need in the future, we would recommend just letting him eat a regular diet and live his life now, so that if we go to use it in the future, he's not like, oh, I remember that time I couldn't have ice cream because you said it could, that a seizure could come or something like that. So with how tricky and how, specific we have to be about switching your body over to that fat source, we would rather, if there's something that you're interested in, work as a team to do it, and work with the dietitian support. But letting him eat whatever he wants to eat right now while he's not doing the diet is probably what he would prefer and what we would recommend.
Sure. I don't know if there's any other questions, but I guess I have a follow-up to that.
Yeah, of course.
We just switched to, well, not switched, but we just had a G-tube surgery about 2 weeks ago. So we're sort of working in blended meals with that. I assume you have plenty of recipes. Do you know if there's any prepared, like right now we're using Kate's Farms blended meals. Do they have a ketogenic option or no?
Yes, they do. There's a formula made by Functional Formularies. It's a keto peptide formula, and it's a whole foods blend. So we do use that for some of our tube-fed kids.
Great. Well, thanks again. It was a pleasure to join.
Thank you.
Thank you for
Other
coming.
questions? I have a follow-up question. What are some of the most common pitfalls in terms of particularly thinking about meal planning and coming up with recipes? What are some of the things that can kind of get families into trouble with either going off ketosis, or are there specific things that are I guess in terms of meal planning that can be tricky, and that common issues or challenges that come up?
I think that a lot of the challenges I've seen are just making like a switch. Like we come into the hospital, we're eating a normal diet prior to that, and then all of a sudden we're eating a ketogenic diet. It is a really big change for kids. So getting used to like tastes and textures, and again, there's a lot of fat in the diet, so like oils prior to officially starting the diet is helpful. Introducing the child to different foods, like a low carb option of some of their favorite foods, is helpful prior to the initiation of the diet. Again, that's like with the diet being planned, and so we're just trying things. Usually the education process is like a 1 to 2 month period before the initiation of the diet, so you have time to trial a lot of stuff. And so we always recommend that. And then pickiness, because they're kids, and a lot of kids love to eat carb heavy foods, pastas and pizzas and things like that. So it can be difficult to make that adjustment.
I imagine there's probably some instances where picking this can actually be almost a benefit. Like if they attach to or really like a few of the key foods in the diet, and it's okay to just have kind of the same few meals over and over again. Is that ever, do you ever see that where the diet can be fairly limited in terms of just a few meals that work for the kid, and then with other kids you have a much more varied diet?
Yeah, so I think that, I mean, we definitely have kids that will eat like the same like 5 meals. It's just what they're used to, it's what they like, and that's totally fine. We always encourage like switching out like vegetables and proteins and different fat options so that we're not just getting like bacon fat. We're not just using butter all the time, like switching those out. But yeah, we have kids that eat like the same few foods, and that's okay. That's what they enjoy. We like to get parents like settled with like a rotation of meals in the calculator so that they have options to give their child.
I think there are kids who aren't on the ketogenic diet that only eat the same 5
Yeah.
meals too. So
Sure.
yeah. I think, Russ, a lot of anxiety comes up around like the time when kids transition to school, and then like every school year, just getting the school staff back on track, making sure that everyone is aware of the fact kids can 100% go to school on any of the dietary therapies. Some may have like a TA or a parapro who helps them out of those things. Some older kids who are like able to do things themselves, but it can be tricky, especially for kids again who like have that ability to like get offered a piece of candy and take it, right? And so that is one area where it can be a little bit hard, and that little bit of sugar can sometimes lead to a seizure. But hopefully they're well controlled enough and that they understand, right, where it's at. I think being able to offer the modified Atkins diet for adolescents can be really helpful, because they definitely will get into that phase of saying like, well, why do I have to do something different? Why, what if I didn't do this today? What if I did just go ahead and eat that food that was not keto safe or keto friendly? And so monitoring for that. I think the other thing that is hard is that sick days. We didn't really go much into this, but kids who are already sort of living in this acidotic state, when they get sick, can tip over really easily and get sick. And so they need a little bit of extra monitoring, not just of their ketones, but just of sort of their overall wellness when they're sick. And that's where the dietitians can be really helpful if you're like, oh my gosh, our ketones are suddenly 8, and what do we do? And the nurses here in the clinic are just calling us and saying, hey, this is what we're seeing, help talk us through this piece of it. If they need antibiotics, those have to come as a pill form. So there's a few little like tweaks and things like that, but in general, they tend to do okay, just like any other kid when they're sick, just maybe need a little support.
Either anecdotally or in the research, have you noticed any other benefits beyond seizure control for the diet? Like, do families ever report improvements in mood or cognitive function or alertness or anything along those lines? Or has that been even studied, or is that purely anecdotal?
I'm not 100% sure how much it's been studied, but I definitely hear about it. And I think it's all one of those like questions that's intertwined of like, well, did the seizure control help with the improved level of alertness, and being able to walk back some meds a little bit help improve with those things? Definitely for children with Dravet syndrome, we hear about it a lot, that like, even though seizures didn't really change at all, parents, for reasons that I'm not sure of, do tend to see like an improved level of cognitive functioning and an improved level of alertness typically on the diet. But so it's definitely something that families see and report to us in clinic.
Yeah.
Any other questions?
I'll jump in again if there's no other questions.
Yeah, great.
I think I saw on the contraindication list that GERD was there. Does that tend to worsen with a keto diet? Yeah.
Yeah, it does. It does. Again, it's not a complete contraindication. It's just something that if you're not already closely working with the GI team, we would probably say like definitely get involved with them first before we put you on the diet. There's a lot that goes on. The high fat diet can make constipation a lot worse. And so kiddos, especially like a fair amount of the patients that come to our clinic who don't have great tone in their bellies, and so they already sort of have difficulty like stimulating a bowel movement. And then we add this high fat diet on that sort of slows everything down. They can get backed up really easily, and then that can make the GERD worse, but also just in general, we do tend to see that. And again, nothing that the GI team isn't used to and that they can't help us with to manage, but it's something that we should take care of before you were to start on the diet.
Yeah, that's kind of our exact scenario. So
Yep. Yeah. But we, again, to say like that's probably at least half of the kiddos that we have on the diet. So we're very used to it and very comfortable working together to make sure that it's a safe thing to do.
I think that's the reason we went with the G-tube surgery more so than absolute. I mean, he's not malnourished or anything. He does eat orally, but he's pretty restricted on the things he can chew. So the tube just gives us all sorts of new options. So it's great to learn about this.
Yeah, definitely. And if it sounds like it's something that your son would be a good candidate for, I would just encourage you to talk to his clinic provider and see if that's something that they think makes sense for him.
Do they, I mean, so it seems like we've stumbled on some pretty success controlling his seizures with medicine. Is that something they'll explore without that, or you pretty much have to fail on some meds before they send you?
So we do like to hear that you've tried at least 2 medicines without, but there are some families that would say like, hey, we're well controlled on 2 medicines or 3 medicines, but we'd love to try to see if the ketogenic diet would be helpful in letting us reduce the number. Like, especially if you're seeing any side effects or you think like there's a potential that there are side effects. Sometimes with little kiddos, like they haven't developed their personality enough yet so that by the time they get on these medicines, we're like, well, what's medicine? And so it would be a very reasonable thing to ask if they've met that criteria for refractory epilepsy to say, like, is this something to at least get some more information about and consider? And the G-tube is a huge helper for that, right? Because it sounds like your son could eat a little bit, or it could eat some things orally. And then we have a lot of kids who will either through the G-tube or just by mouth drink some of the ketogenic diet formulas in order to help supplement and balance out that ratio so that they're not just having to eat a lot of fat. Yeah.
Just curious if either of you have ever tried doing anything approximating the ketogenic diet just to see what it's like.
I have not.
Okay.
I have not.
Yeah.
I feel like I should now. We should have a ketogenic diet dinner party and see how it goes.
Yeah. And so
a lot of kids like love it. Like I think as many families that are like, oh, my kid's a really picky eater. I have a lot of kids that are like, more butter and mayonnaise sounds great. Give me more. Like, so
yeah,
it's not as impossible as I think it sounds on paper or like on that plate that you showed, Chrissy. That was a really
yeah,
a lot of fat.
It's a lot of fat. But yeah, you're right. That like there's some kids that just like it's what they're used to, it's what they enjoy, and it's their norm.
what do you have some examples of, typical foods, like this particularly for kids who have grown up on a traditional diet and then switched to ketogenic or modified Atkins, some like favorite foods like breads and pastas and cakes and cookies and things along those lines? Are there some reasonably tasty keto friendly versions of those things that can be done?
Yeah, some of our kids will use like the 0 carb like tortillas to make like little like individual size pizzas. So use the tortilla as the crust. We have like the keto cal powdered formula where we can use that to like bake things like breads and cakes. There are some low carb pastas on the market. Like there's like the miracle noodles, which have 0 carbs in them. That some of our kids will eat, some of them don't want anything to do with it. Yeah, there are options out there. Again, I think it's a lot of trial and error and like seeing what the kid enjoys to eat, trying to find like a keto friendly equivalent to like their favorite food. Like who doesn't love pizza? So we try really hard to like make sure that they're enjoying the foods that they like. A couple families that they eat a lot of quesadillas with those like low carb tortillas. And then including like vegetables and fruits alongside that.
Right.
I think it's a great time to do it because there's so many low carb options.
Yeah.
But I think the flip side of that I hear sometimes is like the frustration of like, I've meal prepped and made these things for the week, and then my kid like won't eat that after you've made so many of them, or if you put so much money into purchasing those foods. So just things to keep in mind that it's going to take a lot of like patience and tolerance. And, you know, if they're like my school age kids at home, like this week they love a certain thing, and then the next week I make it again and they're like, nope, I don't want that ever again. And so it can take a lot of like just deep breaths and reminding yourself like, be okay. But it also is, you know, frustratingly that food does not get covered by insurance, even though it's a medically recommended diet, right? The formulas tend to get covered, but a lot of this is like out of pocket, and the low carb foods tend to be priced higher than typical foods. So again, just things to like know in the back of your mind if that's something that you're heading into, that you may have to change how you budget things or change your patience for your kids having you buy a bunch of food that they don't end up eating. And Christy, I do have a question. How often do you find like families all together sort of switch over to more of a keto style diet when their child goes on it than just having the child eat their own separate thing compared to what everyone else is eating?
I would say it's probably like 50-50. A lot of families will try to not necessarily follow like full keto, but as a whole, just reduce the amount of carbohydrates that they're eating or preparing for family meals. That way it's a little bit easier to like make the child who's on the ketogenic diet's meal like at their ratio if it's already, that way they're not making a meal specifically like for that child. So yeah, I would say it's about 50-50 that people do that. It's always interesting to me when families do it. And I think it's good because it helps be like inclusive, so that child's not just always eating like their own thing. They feel included in like family meal time, and that's important for them.
I imagine it's a little easier with modified Atkins, but like in terms of going out to restaurants or traveling, is how easy is it, or how hard, I should probably say, how hard is it to order a meal, or you know, if you're shopping in a different location, you know, where you don't know where everything is, to find appropriate ingredients to be able to manage a keto diet while you're traveling. Yeah, are restaurants even possible, I guess, or
Restaurants are tricky because on a
Yeah.
ketogenic diet, you're going to measure every ingredient on
Right.
the gram scale. On modified Atkins, that's a lot simpler because you're just going to be like measuring with like cups. I mean, you can order like a chicken breast and eat that without having to worry about it. As far as traveling, I would say most of our parents or families that have traveled usually will do like an Airbnb so that they have their own kitchen so that they're able to like prepare foods and measure them. And there's a lot of like planning and prep that goes into traveling.
Right. Makes sense.
But they still
It can
do
be
it,
tough.
right?
Yeah, they still do it. Yeah.
Yeah.
It just can be tough.
Yep.
It definitely takes a lot of planning.
And related to that, I'm presuming that meal preparation just takes quite a bit longer than traditional diet. And do you find, like, are there strategies that families use in terms of, like, do some families like prepare all the meals? Like you kind of suggested this earlier, that prepare a bunch of meals ahead of time so that you have them pre-made. And does that tend to be successful, or do other families kind of just do it uh, with each in particular meal, they make it on the spot?
I think it depends on the family and what works best for them. We do have some that will do like freezer meal prep so that they're able to like rotate things so that the kid isn't just always having like the same meal. And then we have families that meal prep for like the week so that they have options. But meal prep does take a little bit more time with keto, again, because you're measuring everything. But once you have like some recipes down and you get like used to doing it, I think it becomes, at least from like what parents have said, it becomes a little bit easier to plan for it and do it. This just becomes your new like routine, your new norm.
Right. I know the Charlie Foundation is one really good website. Are there other websites that families have found helpful for meal ideas or recipes or other guidance?
I know there's a lot of like Facebook groups for families with kids on the ketogenic diet. I think those can be helpful for families. I don't know about any other websites. The Charlie Foundation, we always recommend. There's some cookbooks out there, but a lot of them don't have ratios attached to them, so it can be a little tricky.
Yeah, I imagine it's also tricky given the popularized use of the word keto
yes,
and like sort of weight loss diets or that sort of thing that are not I'm assuming most of those are not actual ketogenic diets. They're not to the level of a ketogenic diet. Is that?
Yeah, they're not medical ketogenic diet. And the kids that we have on the diet aren't on it for weight loss. The ketogenic diet products or keto products that are out there in the grocery store, some of them can be very helpful for our kids that are on the diet. Others have a lot of protein in them, which will bring the ratio down. And that's just because the people that use the keto diet out in the world tend to do it for weight loss, for like building muscle, things like that. So they tend to be higher protein.
All right. Oh,
I think
Paige.
one thing that I just wanted to add, because I think we've said kid about 1,000 times, is that adults can do dietary therapy as well. And we have a dietitian who works in the adult epilepsy clinic who is able to help sort of like continue your care over if you have a child or you're a person who's turned 21 and transitions over to the adult side of things. So I think ketogenic diet was made with children in mind, and it's something that often is like marketed as like something for pediatric epilepsy, but it's really for all epilepsy. And so adults are welcome to inquire about it as well.
Right. And I'm guessing the majority of adults who do dietary therapies are probably doing more modified Atkins, I would guess, just because it's probably just more difficult having had an entire 20 plus years on a traditional diet, suddenly switching to a dramatically restricted diet or different diet. But yeah, I know just from working at Epilepsy Foundation of Michigan, there was a lot of interest among adults in dietary therapies, and there were several people who were able to have quite a lot of success with it. So yeah, definitely not just for kids. But
yeah.
All
Great.
right, I think we'll wrap it up, and thank you both for an excellent presentation and discussion. And this will be added to our YouTube channel, so anyone can watch it going forward. And encourage you to visit our website if anyone has any further questions, and you can also call us. But if this is something that a diet that you're interested in, then certainly talk to your epilepsy provider, and they can tell you, whether it may be appropriate either now or in the future, and let you know next steps. So thank you again, and have a great day.
Thank you.
Bye. Thank you.